Hello everyone, I'm Dr. Tushar Mehta, orthopedic surgeon and a faculty of orthopedics. There is this topic, although very small one, that I'm going to discuss in this video. There's one question that was asked to me today by one of the PG residents, a first year PG resident. I got this on one of the social media platforms, so that kind of prompted me to come up with this small, very, very small video. He said, "Sir, what is this elbow fortress concept?" Fort, I'm sure we all know what you mean by fort. In Hindi we call it killa also. So elbow, in terms of when we talk about stability, it is stabilized by two set of stabilizers. One is static and one is dynamic for sure. The static stability concept is what is called as the fortress concept. I'm sure this image which is there on your screens right now, you'll be able to appreciate what I'm trying to tell you. So the first element of this fort is one of the static stability behind it. So the first most important static stabilizer in this fortress concept is this ulnohumeral articulation, along with the lateral ulnar collateral ligament, along with the medial collateral ligaments. So if you see the first triangle in this fort, which you have to invade in order to go inside, contains the medial and the lateral collateral ligament along with the ulnohumeral articulation. And believe me, ulnohumeral articulation contributes to stability more as compared to the radiocapitular or the radiohumeral articulation. So if you see the second element of this fort, which you have to invade to enter into the elbow, is combined by three things. One is, of course, as I said, the less stable radiohumeral articulation, but along with that there are two muscle masses. One is the flexor pronator muscle mass and one is the common extensor muscle mass, which is on the lateral side, and of course flexor pronator is the common flexor origin that is on the medial side. So what I'm trying to tell you is that in order to invade into the elbow, you have to clear a fortress. That fortress is combined by two things. One is the static stabilizer and one is the dynamic stabilizer. If we talk about the static stabilizers, these are usually the joints, and if we talk about the dynamic stabilizer, they're usually the muscles. So the ulnohumeral articulation with lateral collateral and the medial collateral ligament, the first fort. The second part of the fort is basically the radiohumeral articulation with the common flexor and the common extensor muscle mass. So this is the concept of a fortress concept of elbow, and I think why that question was asked to me by one of the first year PG residents is that normally it is asked as a theory question, very less often in Viva, but usually it is asked in theory question in 2 marks, 3 marks, or 5 marks, that elbow fortress concept. And in that, you're not supposed to write that much. All you're supposed to do is you're supposed to draw these two triangles, one within each other, and you have to draw this diagram. So that'll fetch you good marks. So thank you so much for this listening and hearing, and we'll come up with more videos soon. There is one more video I want to give you all a reminder. I will share the link in one of the comment section as well. There's one more video available. It is on elbow anatomy and elbow dislocation, in which we have discussed the stability of elbow and various sorts of dislocation, about the classification of elbow dislocation at length. You should go through that video as well. Thank you so much. Bye-bye. Enjoy.